Hi, everyone, and welcome to the second session of Digital Dentix webinar series. This is Mahmoud Al-Bashti with you today from Digital Dentix International Academy. It's our pleasure and honor to welcome our guest speaker, Dr. Andres Ponce from Chile. Dr. Ponce will share with us his experience in clinical photography, tips and tricks on the daily practice. Dr. Andres Ponce is a prosthodontist, dental photographer, and marketing advisor at Fox, Chile. In 1999, he graduated with a dentistry degree from the University of La Frontera. In 2008, he got a diploma in static and adhesive dentistry from the Southern University of Chile. And in 2009, he became a specialist in interdisciplinary oral rehabilitation with orientation to aesthetics and implants. In 2015, he got another diploma in local health management from primary care establishments from the University of La Frontera. In 2019, Dr. Ponce got another diploma in marketing, including digital marketing, business management, marketing, and related disciplines from Adolf Evans University. Dr. Ponce is an expert in the field of dentistry with more than 16 years experience in the public and private sector, leading teams, training professionals, and advising companies and institutions on marketing through the generation and communication of valuable content in the dental field on different platforms and media in both English and Spanish languages. So during this webinar, Dr. Ponce will share his valuable insights, practical tips, and innovative techniques that will enhance your clinical photography skills. This webinar promises to be a valuable resource for all dental professionals. We are thrilled to have Dr. Ponce once again to share his insights, best practice, and real-world case studies, providing attendees with the practical strategies to enhance clinical photography and optimize their clinical workflow. So without any delay, once again, let us welcome Dr. Andres with us. Andres, I think the stage is yours. Please share your screen.
Thank you so much, Mahmoud, for your introduction. Thanks to the people that is connecting now. We're going to speak about clinical photography. That's the aim today, and my idea here is that you take a lot of information and make it useful tomorrow. It's not something difficult. It's not, as we said, it's not rocket science. It's just photography. It's just a tool, but we can do a lot with this. So this is the aim today, and this is what we want. And this is what I want basically to share with you to make it more easy, affordable, and accessible for every one of us in dentistry as a useful tool, basically. So let's go there, clinical photography, tips and tricks for your daily practice. That's the title of this, that's me, of course. If you want to connect me, the most important thing here is not my picture and it's not my resume. The thing is that you can scan those codes. And those codes are going to take you to two places. One, my account, my Instagram account, so you can reach me there. And whenever you want, you can send me a message or whatever you want. Or you can go directly to Focus. That is the group of photography that we have with other colleagues. And we have a great team there, doing courses and everything. So whenever you go, please contact me. I'm here for you, basically. From now on, we're going to be friends. Photography is not another thing than photography, Dental photography is just a part of photography and basically is a mix of different techniques. Photography is part of the product photography, portrait photography, extraordinary photography is photography basically based on things like, publicity and portraits. So there's no need to think that it's another discipline or specialty in dentistry. It's just photography that is applied in our field. So there's no problem at all to do this, okay? So if you're thinking that it's going to be complex, it shouldn't be complex. You have seen maybe many times pictures like this or like this in surgery. Surgery is complex, but not because of the pictures. It's complex because of the situations that we are. Prosthodontics, of course, to check sometimes some details. Of course, we're thinking about it So it's sometimes you see pictures like this are related with aesthetics, you know, in this case is veneers, or pictures like this related with prostate. So well, you can apply in a lot of areas, you know. It's not difficult if you think or you take the pictures as an ally basically for your daily practice. That's the thing. It's not difficult at the end of this lecture. Maybe you're gonna understand how these pictures are made. So it's not going to be something difficult or complex to understand, you know. There are different areas that are applying pictures or photography, and of course the results should be good just if you have the right guidance, you know, or if you don't have any experience about it, it's going to be something very easy to do. Okay, so let's talk about photography because there's always a first time. I have made a lot of courses around the world, and these I've been lucky to see the first time many people, you know, starting with pictures. So I have some videos about it, you know. This is one. This is the second one. They didn't know how to do it, you know, but they have all the equipment. So we go there, you know, and show them how to do it. You know, it was easy. First picture, well done. Mike Sonic, my friend from Clarksville, Connecticut. Easy. Portraits. Sometimes people think it's complex. You just need the right guidance. We're going to speak about it. Nice picture. Nice lady. Marketing pictures. Pictorial pictures, of course. So there's a lot of things that we can do with photography, you know. It's a big tool. It's a great tool for everyone else. Let's start with the basics. Let's talk about photography and the concepts of it, you know. Dark room. Dark room is something that started on Renaissance, and it was basically used by dentists, or not, sorry, not dentists, artists that were not so skillful like the other ones, you know, like the famous one. So they go inside a box, you know, in a little hole, and they project everything that happens outside. And they take this image, you know, from the outside on the wall, and they paint over it. So they obtain basically a copy of what is happening outside. That's the basic principle of the photography. Then in the 19th century, a guy, you know, that we can see on the bottom there, you know, take these concepts and create a small box with a lens and with a film. With that, start the daguerreotype. And the daguerreotype basically is the first camera of all times. And this is a picture of 19th century from Paris. So you can see that now we're taking shape on what is photography basically. But we have some concepts that are important to understand, you know, that's still working today based on that optics concept, you know, from the past. So we have four elements that are very important in photography, and we have to understand every one of them. One of them is lens, the other one is diaphragm, the shutter speed that we're going to speak about it. We're going to speak about every one of this, so don't worry about it if you don't know what is happening with every one of this. And finally, but there's a lot of importance about it, you know, it's sensor. This is the complex image, of course. It's a camera. It's a reflex camera because it has mirrors inside, so you can use it, and it works very well today. But this is the real image of what is happening inside, you know, all the structures that are involved on this process. Let's talk about this concept, you know, we're going to detail every one of them and how they work and how you can manage this, because the idea here is that you start work on automatic, not automatic mode. Manual mode should be the one that allows us to take the pictures that we want or that we're searching for, okay? So let's take it. Let's go there. The first one is going to be shutter or shutter speed. Usually you're going to find this like a number like this as a fraction, okay? As a fraction, the meaning of this should be that we're talking about a fraction of a second. For example, this one should be 125 parts of a second. So it's a small piece of time, basically. If you want to freeze time, of course, it works very well for pictures like this, but this is not a typical picture, dental picture. So you have to think about what is the real use of the ISO. And in the shooting speed, in this case, it's going to work as a speed adjustment of the shutter to control the amount of light that is inside on the sensor. So basically, we're talking about time. That is the meaning of this. But how this is going to help me on the daily practice? Well, we live in dental practice, we live in a small world, right? So we're using macro lens. The macro lens is something that works as a zoom basically in a small world. So we're increasing the size of everything basically because we use a macro lens. And the macro lens should help us to obtain pictures like this because you're gonna avoid all the problems with the movements, the dental chair, your assistant, the patient is breathing, that is shaking, you maybe with the camera and everything. So the right adjustment for shutter speed is going to help us to obtain very clear pictures with no problem, even if you move a little bit. The radio of the ride, setup for this should be 125 or 250. We're gonna work on that range. Shutter speed shouldn't be less or more than that one. Ideally, it should be 125. With that, we're gonna obtain our first setting for shutter speed, and you will see that it's gonna work very well. Don't forget that this is a part or mechanism from inside the camera and it works like this, so it shouldn't be any problem with this. You get that? So it works. Of course, this is a very slow motion, picture, it's a video from how it works, but with that, you can understand. If you put more time on this, of course, not fractions of the seconds, I'm talking about complete seconds, for example, in this case, are 10 seconds, you're going to obtain these typical pictures. It's just an example because there's no need to think that we have to do this in dental practice. There's no use for this, except if you want to do some artistic pictures, something like that. In the other hand, if you use, for example, a shutter speed of 320, you're going to see that 320 are basically going to freeze the time. And when you do that, you take pictures like this, right? Pictures that are going to help you to freeze the time, and make everything that stop in a second. Usually, you're going to see this as a number, we already know that is a fraction of a second, or maybe it can be a complete number, like in these cases, these are different cameras. This is a mirrorless camera, but usually you're going to control this with a wheel, okay? A wheel is going to help you to manage, to change the setting of this part of the camera. So usually you're going to control that like this, okay? Another thing that's interesting to understand, is the concept of trepidation, that basically is that focusing. And the focusing means that you're gonna take a lot of pictures. It usually happens, I'm gonna speak about based on my experience too, not the only because it's something that I have studied, is because something happens, you're doing cases, for example, clinical case, you take a picture, next step, another picture, you're taking pictures of a long, procedure. So when you go there, finish and you're happy to watching your camera because it's a small print and you're hard with the patients and everything. So you see that and everything's going to be clear. Then you go home, then you take some time and watch this on a big screen, for example, on the computer, and you're going to see that not all the pictures are clear, The shutter speed is going to help you to avoid that small movements that are not going to make this picture clear. So that's why it's important to use this, as our favor. Okay, the focusing should be avoid with the shutter speed, and we know what's the number. It's 125 to 250. That should be our right setup for the camera. If you still have problems with the movements, those small movements, and pictures not clear, you can use a tripod. It's not common, but you can do it. It's very useful, especially macro photography. When you do macro photography or you're taking product photography with a lot of detail, well, it's very useful. In this case, we use this because we were in a course and not in the right conditions. So we were trying to emulate a dental chair, in a clinical situation. So we take this picture and the result of this. You see, so it's possible to do it. It's not a problem. Or when you do, for example, macro pictures with a lot of detail, for example, like this one. This is a a small mini implant, with reduced diameter from Intralock. There's a company from BioHorizons, and this implant is it's about 2.4 millimeters, so it's very, very small. So you can see that there's a lot of detail there, and that is because we're using a macro lens, the right setup, and of course we're using in this case a tripod. So with the shutter speed on the right way, you're gonna obtain a lot of macro pictures very clear with a lot of detail. Sometimes you will think maybe I don't know, 100 or 200 is going to be the same thing. There's no big difference. Well, we have a picture so here to compare on the screen with all the information. So it's a real picture. Change it just a little bit with the settings, and you will see that there's a difference there. You start to see difference. So if you want to obtain clear pictures, the right setup for this is going to be helpful to obtain a pictures like this. Okay. Or pictures like this, with a lot of detail. So as a resume of the shutter speed, we have to know that if we have more time of shutter speed working, everything is going to work. It's going to see like it's moving. And of course, if we have less time, everything is going to be, blurry. So not blurry, it's going to be very clear, like when you freeze the time, basically. Okay. Other option that the most of the macro lenses that is very used on our dental field, is the VR option. For example, in Nikon, I'm a Nikon user, that's why. But I guess all the macro lenses of good quality brings with that option. So VR or anti-vibration system works very well. So you have to be sure that it's going to be activated. The other thing that is important is to work, in manual mode or automatic mode. That depends on you. Basically, with the manual mode, you're going to do this, try to use both hands, to focus. I prefer to do it in automatic mode with the focus. Don't forget, I'm talking about the focus mode. The focus mode with the automatic mode, because basically you can control that with a finger. Then you press the finger, it's going to focus, the lens, and then you shoot, and that's it. Let's talk about the second element of this triangle. This is going to be the aperture. Aperture is going to be found like this. Generally, is going to be found as an F with a number. And this is a arbitrary number, it's not because you should find this one. But for example, this number means that we're talking about the depth of field, basically, in aperture. Aperture is going to be inverse according to the information that we have. For example, if we have a value of f of 2.8, it's going to be very open, basically. And if, for example, the f16 is going to be a small hole. So they are not proportional according to that diameter of aperture. So you have to understand that. There's some difference, of course, on this, because basically with one, you're going to be very focused in just one small part of the subject, and the rest is going to be blurry. On the other hand, if you work with a big number, you're going to start to see everything clear. We're going to see some examples about it. For example, this one, this is an f8. And f8 is something that is very clear on the first teeth. For example, we can see these nice droplets, and it looks very nice, and artistic, and whatever you think that it is, But basically, the second teeth is not there, it's blurry, and the third one doesn't appear, basically. So these are the kind of pictures that are not useful as information in dentistry, but for example, if I want to use it to show something specific, I would take exactly the eyes of the people there. So basically, I can manipulate a little bit, what the people see about the picture, So we have a whole picture here, but everyone is going to be watching just the teeth that I'm cementing, in this case, a veneer, It's useful in some cases, if you're going to speak about some specific topic and you're using a complete picture, maybe you can focus on this specific one, talking about cementation, for example, or in this case, a control about implants, same situation, or when we talk, for example, this was used for 3M, is talking about cementation. So we're showing the background, the Relax Ultimate or Universal. No, Ultimate was cement. So in the first, you can see the crown with the cement So it's different, you know, if you depends on what you're going to use. This was used for a catalog of KG. I don't remember exactly the name, but it's a Brazilian brand of burst. And we use this because we're showing the use of this to create, you know, the margin and the chamfer of the preps. So you can see exactly the burst and the teeth that is already prepared there. So you take the information, so you put the information there, and you take the eyes of the people there, you know, on that point. This was from Meisinger, you know, same situation, or this one, you know, or this one, for example, as a veneer preps. So these pictures are useful in some cases. Other ones are basically, you know, very artistic ones, but it's not the real use that we want. On the other hand, if you work with this, for example, you're gonna see that we have an F20. We increase the value, we raise the value of the depth of field, and now we can see a lot of information. There's a lot of depth there, you know. So with pictures like this, I can plan a treatment, for example. I can plan a treatment, I can plan a DSD, I have a lot of information about the patient, you know, how it comes to me, you know, on the first session. That is something that I do a lot. Or maybe it's the control session, you know, the after treatment session, you know, depends on you. But with these kind of pictures, you're gonna have a lot of information about what is gonna happen with your patients. Or pictures like this, for example, this was for a case, and we were comparing, you know, feldspathic veneer with a zirconia crown. Very good work by the lab, by the way, you know. But you can see a lot of information about the preps, about the teeth, how they are, you know. One was very damaged. You can see on the color there, and the other one is very, very superficial, you know, because we were working with a veneer. So these are different situations, different points, you know. Start with the treatment, but you can see a lot of information. So that is because we were working with a F value that was maybe or should be around 20 or something like that. So you can see there's a lot of things that are important, and this one is very important to understand because we all make mistakes. And of course, in this case, we can see the pre-op, the post-op, you know, and the 1 year follow-up. And you will see that there's a lot of information here that is important and relevant for the treatment, for the following up of the patient too, you know. But the thing is that we have problems here. For example, the depth of field on the first one is not the same one that in the second and the third one. So there is there we have information that is important, you know, to understand, because there's a mistake here. You know, the depth of field is not the same one on the whole pictures. The white balance is another problem, you know, because we don't have the right white balance here in the second one. Basically, one is of the thing that is important here to understand that maybe the flashes light change. So if you change the flashes or you do some changes on the setup of the camera, you should know about it, you know, take the information as you take notes, for example, of your patient. What do you do, the technique, or the material that you use, you know, on the treatment. Maybe you should take some information or create a protocol that you would be replicable on the time, you know. So with that information, you're going to see that maybe the picture that I took 2 years ago is going to be the same one than today, you know. So you can compare the information and avoid these problems, you know. That is not a big problem, but when you want to compare, for example, you're going to see that it's not the same picture. Okay, or cases like this. The idea is that the first picture and the last picture looks the same. Of course, everything is going to change there because the treatment changed, but the idea is to obtain a picture that looks the same on the first one and the last one. Pictures like this, for example, you see, or pictures like this. See, you only see the difference of the treatment, not because the picture changes. The patient changes, but not the picture. You see? Pictures like this, for example, another case of veneers, because I do a lot of cosmetic dentistry, and most of my patients have veneers basically. So if we see the picture, you know, you're not gonna see a difference on the picture. You're gonna see the half of the treatment done and the pre-treatment of there, you know. But it's basically because I take the picture and divide it by 2, and mix it, is those pictures mix it, so this shouldn't be difference on the light or on the setup of the camera. It should be the same one, okay? And of course the faces looks good, you have to think, we can speak a little bit about marketing, but of course it depends about the audience that you're working for. For example, this one works fantastic for dentists because we, the dentists, love the teeth. Basically, we live and work for that, but it's different when you show a face. So this should be the right picture, maybe the before and after for patients. I guess it's a better option. So let's talk about ISO. ISO is another element that is very important, but when we work on dentistry with ISO, it should be in a low value, okay? Low value. ISO is International Standardization Organization. That's the meaning of this. There's a lot of people in Europe that is working on always trying to measure things, and try to qualifying different ports, different things on the world. For example, I don't know, maybe if you hear about ISO 9001 or something like that, then it measures the quality of different business and things like that. So they standardize this, and call them ISO because of organization. And basically the ISO means that we're talking about pixels. When we talk about pixels, we talk about the sensor of the camera, and the pixel, and every sensor should have a lot of pixels. Basically, every pixel is composed by 3 colors. Those colors are red, blue, and green. The combination of these colors are going to create the image, basically, in different densities and of course quality. But the problem with this is that we shouldn't speak about ISO, because in dentistry we should work with light. That should, for me, should be the 4th element here. But in the classic photography, it's not contemplated because we talk about only about these 3 elements. But if you have extra light, I'm talking about flashes, for example, that is very useful because you can work on dental photography without flashes. We shouldn't be speaking about this, as an importance, because this should be always on 100, the lowest value of ISO. So if you work on 100, you shouldn't have any problem with this. But if you start to work based on the ISO to obtain a good picture, you're gonna see some problems. That one of these problems is the noise. The noise is a problem, it's a real problem. These are 2 examples, of course, not dental examples, but are very similar in some parts because of this. Times Square, for example, in New York, is a dark, at night it's dark, especially in winter, that you can see. But we have a lot of extra light basically there, so if you have extra light, there's no problem. The picture is going to be clear. That is exactly the same thing that happens, into your mouth or the patient's mouth. I mean, when you take a picture. So intraoral picture is a real problem if you don't have light, even if there's a lot of light around, because that light is not going to be around for you. It's going to be just because it's daylight or things like that, but it's not going to do the job basically to take a nice picture, or a clear intraoral pictures like the other one. We have light there, on the right one, but you start to see those small points, there on the screen, on the image, and that means that you have some noise, and we don't want noise on the pictures. So the solution for this, of course, use flashes. Flashes should be the right decision, and we're going to speak about it, of course, because we're going to speak about equipment. About the triangle, this is the triangle, the real one, with a lot of information. There's a lot of information here, and everything we have been speaking now is going to be resumed here. So this is the thing that we have to understand, that if we change some of the parameters, the other one is going to change too. Let's talk about equipment now. Equipment, lenses. We're gonna find a lot of lenses, not all the lenses are similar, but we can work with them with no problem, but the main one should be here in prosthodontics. For me, for example, on dentistry, should be the macro lens. The macro lens is similar to a zoom lens because we bring all the image that is there, to a close position, so you can watch what is happening with this. Just like here, of course, a zoom do the same job, but with more distance, but in our case, is going to be something related with our macro or micro world, basically. So we increase the size of these small objects. We have different kind of lenses, variable work and distant lens are not good options. So if you buy a camera, you shouldn't buy the lens that comes as a gift with the camera, because it's not the right one for dentistry and it's not a good lens, basically. Okay. They have low luminosity and low quality image because they have a variable working distance lens. They try to do a lot of things basically in the same lens, and of course that means that the light is going through a lot of different lenses and crystals. So the final picture is not going to be a good one. The macro lens for me, the gold standard if you want to do dentistry or prosthodontics, should be this one, the Nikon 105 or Canon 100 or something similar. Is for me the ideal lens, and with that you're gonna obtain a lot of detail, a lot of information about this. So it's the right one if you want to work on dentistry. If you're a Nikon user like me, you're gonna love it because it's very good. Another thing that we have to understand about the lens is that not all the lens works for dental photography because they have distortion. That's why it's important to understand what can I do with a cell phone, because the cell phone is not going to do the job. Again, all the electronic devices, computers, cameras, and different, kind of devices works with a wide angle lens. So they have a lot of deformation basically about the image. So if you want to work on the dental field, well, the macro is going to do the job, of course. But there's another lens that want to work too. For example, the 50mm lens works very well if you want to do portraits or extraoral photography. So it's worked very well. Let's talk about cameras and equipment. Types of camera are very important. We already know this one. The compact camera, they don't exist. It's very difficult to find on the market now, these ones, because these were replaced basically for the cell phone, so no one is using this. The reflex camera is the most common camera. I work a lot with this one, and it's very good. They do the job with no problem at all. And we have the new kits on town. Basically, the mirrorless, is more expensive, more compact camera, and they have very good quality, but the price is not so affordable in some cases. If you want to work with some brands, maybe the Sony Alpha 7 is going to be the right one for you, not Nikon, not Canon, because they're new on the field of this camera, and Sony is working on this from more than 10 years. So if you want to invest your money in a mirrorless camera, I guess Sony Alpha 4 is going to be the right one for you. But again, you have to buy everything again. If you have your macro lens and everything, or flashes, well, flashes are not a problem, but the lens is going to be a problem because you have to buy the lens too. Okay. Talk about the sensors again, and this is the difference why we are not using cell phones to take pictures, because the picture is not going to be good. Maybe you said, I have the last iPhone, I have an iPhone 14, I invest a lot of money in my cell phone and it's very good, so it should take some nice picture. Well, let me tell you this, the sensor of that is not very good because of the size. It can compete with a real sensor, like, for example, like APS-C, sensor, or a full frame sensor. By the way, there's no need either to buy the full frame. You can use an APS-C, in case of dental photography. With that is enough, because that is the line of semi-professional. The other one is a professional camera. So you have to think this. You want to print your pictures on a full screen, maybe, and put it on the side of a building, for example, or on a board on the highway. Well, if that is the case, maybe you need a full frame. If not, there's no need to use that one. So there's no need to invest a lot of money in a full frame, for example. The most important thing here maybe is going to be the light that comes from the flashes. The lens, of course, is something very important. And then finally should be the body of the camera. Okay. And talking about that, we're going to speak about the flashes. Well, there's a lot of setups, a lot of equipment. I have been with all this, and I have a lot of equipment here that I don't use anymore. That's why I'm trying to give you this information. The stream flash from Nikon, were very popular, and it was like the right direction to illuminate, in our intraoral pictures. But the problem with this is that they have a very rare battery, the power is not too much and the price is expensive too. I have those ones, by the way, so already did that, and that's why I'm trying to give you this piece of advice, basically, because there's some problems with this. We the dentists, we love to be in this situation always, we cry about this, we laugh about this too, but we like to spend money on things that we don't use, basically. So my recommendation for you, if you want to do something similar like this, it should be this one. It's Godox MF12, MX12, do the job. Basically, it's the same thing, same concept. Of course, it's Chinese, so they take the information and do something better, basically. So we have this equipment that is a Godox MF12 that is the same concept, two flashes, twin flashes over the lens. And then the difference with this is that they have more power, are very easy to connect. And the other thing is that they have an inner battery. So they comes with a battery that's going to be charged on, for example, on the computer, in 15 minutes, and it's going to last a lot, so we have a lot of energy there. And you can charge this with a connector, like a C-type connector, for example. So it's going to be very fast. So for me, and the price is this third thing, is around $200. So it's very, very affordable, it's very easy to obtain. And I guess it's a very good option compared with the other one, that is not the right one for me. And again, I'm not telling you because I think that I should read or something like that, it's because I already spent the money on that. So I'm trying to give you the information. I have those flashes. I don't use it anymore. So I'm trying to give you the information because I guess this is something that works much better. Other option is speed lights, the typical, wedding photographer, flashes. These are very, very cheap. The price of this is around $16. You can find it on eBay. It comes with a trigger, a wireless trigger, so you can use this in a very easy way. So it's very, very simple to use. So you can buy a couple of this, and then, or maybe 3 or 4, and you can create your own studio with a little piece of money. So think about it. It's a very, very good option. We have modifiers about the light. We have on the one side diffusers. That is a small box. In some cases, you could have here maybe about the soft boxes. I'm going to show you how that works. And the bouncer. The bouncer is something that rebounds on the light and surface to create a softer light. Let's talk about studio flashes. Studio flashes is the favorite one for me. If you want to create stunning pictures and pictures that looks great, or if you want to create some portraits, this is going to be the great option for you. I used to work with this one. So one of the interesting things about this is that are going to be connected directly to the power. So you're not going to have any problem with the batteries, for example. And you can do a lot of things with that, even in color pictures. Product photography, for example, like this one, or portrait photography, like this one. And there you can see my friend Christian Brenes from South Carolina University, my colleague on the practice, an old teacher of mine, our team. So there you can do a lot of it. It's very versatile with this. Then you can see, for example, using my friend Warner from Focus team, you can see there he's using speed lights. Do you remember the wedding photography pictures, flashes? Well, there you have. That is a very, very good option. A couple of those. You don't need too much space. If your practice is not too big, well, this is a very good option. You see, even you can use a ring flash, because the most important thing here is to understand this. The most important thing, or the most important part of the equipment, is right behind the camera. That's the most important part of photography. Here, Sosten is using a ring flash with a glove, basically. It's a glove with air inside and create a softbox. And with that, you can take a nice picture and use the ring flash. Because, by the way, I don't like too much the ring flash. I don't like the light about it, Other things that are important, the contrastor for me, Style Italiano, Smile Line brand is very good. I guess they are the best ones on the market. So you can invest on this and you're going to have eternal, basically, contrastors. It's a copper plate, covered on silicone. So dark is going to be really dark and opaque, and you can manipulate and bend that as you want. So it's going to be useful. Retractors is another thing that is important. I prefer black ones because with that you're gonna have an image ready to edit. Black always is useful if you want to edit the pictures, and it's going to be clear. So it's something that works very well. You can train your patient for this, for example, to help you in a couple of minutes. The patient is going to understand the orders about this. So there's no need to be there, you doing stuff, Your dental assistant can be helping you in other stuff. You can take the pictures and you can train the patient in a couple of seconds with this. Then the use of contrastor, in this case, Smile9, works very well because it's very, you can see, you can bend it, and use it. Easy, right? And now we start to understand how those pictures were done. For example, if you use a contrastor there, a retractor there, you're going to obtain this picture. And that's it. You see? So it's important to understand how this works. Of course, this is the same technique that the other one. We have one light in 45 degrees against us, and then you take the picture, and the other in the opposite angle. Again, same technique, same technique. I always take the pictures, from my dental chair on the other side. Then you edit that, you turn the picture around and you will obtain this. I take the pictures like this, even anterior sector, it's easy, much easier. I'm using the studio flashes there and you will obtain that. So the position is important. Yes, it's important. Control, surgery, even in anterior sector, you do the same position. Is very easy. So the question is, can I do the same thing with a cell phone? Well, maybe no. No. Well, it's not possible because we already speak about that. There's a lot of things, distortion. We have the problem with the sensor. It's very clear, I guess, right? You can do the same? No. But a couple of years ago appears this device. And I was thinking, I had to take this and test it, so I already bought it. It looks like a great idea, by the way, it looks like a great idea. So I use all the setup, I take the picture, I use my cell phone, and this was the result. Not a good result. So that confirms that the cell phone is not going to do the job, even when you have the right equipment. Of course, not cheap equipment. It's a little bit expensive. So the message that I want to give you is try to think first and try to invest wisely. Because if you invest wisely, well, we're not gonna you could buy things like this one, that are not gonna be used anymore. So we want to have the right equipment. So the question again is, can I do the same with a cell phone? Well, now I'm not sure about it, because we can do other things with a cell phone today. For example, this one. This is a small lens that you can attach to the cell phone. Here we have a friend, Deborah, from Manhattan. She's doing video with that. Video is a different thing, it's a different thing. So you can obtain video with this, and it works really well, So video is going to be a great tool today, even if you want to share videos, on Instagram or Reels or TikTok or whatever you want to use for social media, video is going to be something that is going to be very clear and useful for us, The polarized filter is something very common and very used. To be honest, I don't take color. The lab do that job for me, but it's very useful if you want to take color without the shiny surface. So it works really well. Mirrors is something very useful too, and you should have a couple of those because they work really well. The position is going to be the same on the upper side, and in the lower side, you maybe have to change a little bit, the position, but it's not difficult. It's basically geometry. Basically, geometry is about the angles and just that. Okay. If you obtain these pictures, of course, sequence about treatments, even micro pictures like this were made with a mirror. So it's important. The focus is another thing, the focus, we know how it works. I prefer to work not on manual. I prefer to work on automatic mode because it's much easier. So I can control the camera with just one finger and with one hand. It's much easier. You're gonna see the focus like this in a reflex camera or a surface on a mirrorless camera. Talking about information too, the language of the digital equipment is binary language that is composed by zeros and ones, and that compose the bits and bytes, and formats that we're going to work. The more commons are JPEG or RAW. RAW is about the whole information about the camera, so you can read that later. JPEG is going to be compressed, but it's going to just to be the 10% of the whole picture. So depends on you, basically. What are you going to do with this material? The memory card isn't something important, you know. There's not all the memory cards are the same. Try to search for the right one. C10U3 should be the right one. Check your SD card. Maybe you're gonna see a lot of information there that you don't know, but it should be C10U3. You're gonna find that on the label of the target. And why it's important? Because it's the velocity of the speed of the transmission of the information. When you download the information or when you put information on the card, you know, it is important. And the new equipment doesn't allow you to work with that kind of old, for example, transmission, you know, or low transmission. About the white balance, you know, the white balance, the right ones should be in the middle, and the middle is measured on Kelvin grades and should be 5500 Kelvin grades. Okay, you shouldn't work with something that is warmer or colder than that. So my message from me to you is, do not mess with the white balance. Leave it there, you know, there's no problem with that. If not, something like this is going to happen, you know. Same case, you know, than the other day, you know. And the thing is that we changed the white balance in the middle one, in the second one, you know, and you'll see that everything changed up the color. So it shouldn't change that, you know. I shouldn't change that, you know, but it's for some reason I changed it, you know, and that's the result. We don't want that. Let's talk about portrait protocols. You know, of course, this is the first time for portrait protocols for every one of us. This is for me, it's Sarasota. From this year. Right guidance. Good. She's happy with the result. Noah, Solution, University of Florida. All these pictures are about, you know, people that is taking picture for the first time. And of course, the intention and the light is going to help you a lot, you know, to create a mood or according to what is happening there, you know. So we can make look this guy, for example, that is sad, you know, in dark. Maybe he was, I don't know. It looks. I always joke about this, you know, because this one is like he was in jail, maybe on drugs, and the next one is happy, you know, really, you know. It's happy, it's great. So you can create a mood, basically. You can create a situation. You can create how this picture changed. And this wasn't the same session, of course, you know. So he's a colleague, you know. We always laugh about it, you know, because I know him. It's a friend of mine. But the thing is that you can create the mood of this. It's important, you know, to create confidence with the patient, you know, because the patients are not models, so they're not used to work in front of a camera. So if you want to create something like a nice picture of the patient that is very relaxed, you know, and talking about their feelings, you know, and how they feel about the dental treatment, you have to take some confidence from the patient out. And that comes with the time, you know. It's not easy. It's not so simple, you know. So we work with models on the course, of course, you know. It's not difficult to work with them because they know everything about, you know, how they pose, you know, the emotion that they have to transmit, you know. But if you obtain the same control with the patients, you know, you're gonna see some pictures like this, for example, you know, when you can analyze the smile, for example, like this one, you know. Different times, different situations, you know. Simple protocol, you know, for pictures, in this case for anterior sector, you know, or pictures like this. Not necessarily the picture should be the right one and the first one in the next row of pictures, especially if you're going to use this one for marketing. There's no need to go exactly to the same picture, or LinkedIn pictures, for example, or professional pictures, you know, portrait like this for colleagues. The typical one, you know, a simple protocol should be this one, you know, relaxed patient, smiling, profile in both sides, you know, intraoral pictures, frontal, 45 degrees on both sides, occlusal ones, and that's it, and contrastor, of course, if you're going to work on anterior sector. But all those pictures were taken, with just the flashes of 45 degrees against the patient, just that, like these ones, you see. So there are different techniques for portrait protocols. This one should be vertical, so you may look the patient a little bit thinner. Of course, she's a model, so there's no problem with her there, but it looks fine, in the pictures, but it works really good, and cross-light techniques, that is one in 45 degrees and the other one on the other side. So you're going to have light here and you're going to have light here. It works very well. 45 degrees against the patient or the subject to create these typical pictures, very well illuminated. One light, for example, to create this situation more simple, like it was the sun. Cross light technique again, is very well used. One light on the upper side is to create some atmosphere there. Of course, the ambient light is going to work very well. Cross light again, cross light again, cross light. One light to create this portrait, it works very well to see, for example, the anatomy of the teeth. But if you create a portrait, the same situation, cross light technique again, cross light technique again, You see, it's very useful, very simple. It works really, really well. This was created with bouncers, because basically we are shooting the light to the ceiling. Again, very soft light. White background that works really well. Both, for example, those two softbox, one on the back side and the other on the front side. Let's go for some tips and tricks to finish this lecture. We already know about the movement. Shutter speed is going to help you a lot to obtain this kind of pictures. But if you want to take a picture of this part of the enamel, the light should be on the same direction of the incisal side. We already know about the shutter speed too, how to stop the time. And it works really well in different situations, but in dental field, it should be something like this. So let's talk about, we already talked about this picture, or this one, but with the right setup on dentistry, you should obtain something like this with no problem at all. The angle is important because the angle is going to change the light reflex on shiny surface. For example, this one is one light in 45 degrees against us, but if you change the angle, everything changes. You see? Surgery, we already know how to do it. This is one light in the other side, one light in 45 degrees against us. Cross light technique, two lights in 45 degrees. Cross light technique again, the same one that we use for subjects, we can use on products, and it works really well. Same one again. Cross light technique, one light, two lights in 45 degrees, one light against us in 45 degrees, one light in 45 degrees against us. White background, you remember that, we have one background, also one flash with softbox and the other one here. We create a sandwich, basically, white background, white background, white background, white background. Cross light technique, 45 degrees, white background. For the end, I'm going to talk about the apps. It's very useful to work with the apps. When I was preparing this lecture, I saw a picture that it was important for me because I didn't have any picture about mirrors, but I take the picture with the cell phone, and then I did this. How did I do this? Snapseed is very useful if you want to edit your pictures in an easy way. You can take a nice picture, of course, we're not talking about take pictures with the cell phone. But of course, we need to tweak it a little bit, so you can do that with Snapseed. That works really well. Basically correct, some elements like the bright, the contrast, the saturation, And that kind of things are going to be very helpful to make this picture looks even better. The quality of exportation is going to be very good. Today we can work with the cell phone. If you want to edit pictures, I have my cell phone full of pictures, and of course those pictures were taken with my camera and flashes, but that doesn't mean that we can edit the good material. It's like when you cook. If you get good ingredients, of course you can create a lot of good pictures with that, and that means that we're gonna did this in an easy way. So it's very simple if you want to take nice pictures and then edit on your cell phone. For example, I have a lot of pictures like this, on my cell phone. So you can take a nice picture and edit on your cell phone. That is a great combo. Not on the other side, not take pictures on your cell phone, and do great pictures, because that's not going to happen. But the tools, the apps on the cell phone works really well. Even I have tested this was in 2021. You can see there's no problem at all. All the videos and pictures were edited on a cell phone. Photofox is the same thing, but it works like Photoshop. So you can work on layers, you can create different stuff here, and it's gonna be very easy. So you can create a lot of things with this, add logo, text, and everything. Videos, there's a lot of videos available, and we do a lot of this. So you can create videos with your cell phone. If you take some nice picture with your camera, and all the equipment, then you can take all the information, all those pictures, and put it inside your cell phone and do some nice videos like this. For example, resume a case in a couple of seconds, to transmit some information, to share some information with colleagues, is important. So you can resume everything there. This was made with a cell phone. Good pictures, great video, camera, cell phone, you can work on that. If you don't have pictures, for example, videos, you can create videos with pictures. Pixaloop or Motion Leap is a very good tool to create videos, small videos. And with that, it's going to be enough to create something fun, to create some movement or motion into videos. For example, on this one, we're going to give the direction of this fluid that is going to be the silicone, and then you freeze the rest of the picture, and then you're going to see that, let's see here, look, everything is moving. So it's easy. Then you can export this. If the picture was in good quality, it's going to be a video easily, in 4K with no problem at all. And to edit, if you have some expertise, with iMovie, for example, this is going to be very easy for you, because it's something that works really well. And with this, you can create a lot of things. For example, videos like this. Good picture, motion leap, video leap, everything combined. So it's very easy to combine the different elements, and create things like this, or maybe you can create something from a video and transform completely, because the video editor is going to give you a lot of options, even change the colors and the appearance of the video, not only the picture like we used to do. So in this case, this was created, it's a video recorded with a cell phone. You can record video with a cell phone and create something fun with that, and this case was for a client that is Hios and Austin. We created this one. And this was created with a cell phone. That's it. 20 minutes, not much more than that, and the job is done. Or videos like this, social media, to explain your patients, to share information with your colleagues. If you're working, for example, in implants, you have to do a class, it's much easier when you speak like this. With this information, on your side, it's much easier to make it understand to the people, After something that is trendy or works easy, To assume a case. or this one. It's the last sample, you know. We saw this case, but this is the whole case. We're zooming 45 seconds or something like that. This was the same case that we did before. Well, as you can see, there's a lot of options. There's a lot of things that you can do. We have a lot of information now. Of course, now that your things that you have to take pictures. The base here is to take good pictures. With good pictures, you can do a lot of stuff, and you can communicate easily, and you can create more content, you know, for social media, university courses, or whatever you're doing with that, you know. But it's a message. It's a way to communicate, basically, and that's the main message here. If you want to connect with us, guys, well, we have a code there. You know, if you want to scan this, you're gonna have access to article. This is our team, you know, Paolo Sebastián Fuentes, Paulo Wilson, and myself here, you know, the focus team. We have different courses everywhere, you know, so we're always doing stuff. And of course, not only photography, we work some veneer with the anterior aesthetic, you know, course, or the aesthetic periodontics team too, you know. So we have different things to do. We're always trying to do good dentistry, basically, you know, communicate this. Thank you so much. Mahmoud,
Thank you so much.
thank you so much for the invitation
Andres.
to share.
Yeah, thank you so much. It was very, very interesting. You know, the good thing that, Andres, you made everything simple. And I think that's very important, you know, when you try to make things simple so people will love it and they will try to use it. So you dive with us through a very important aspects of clinical photographies and tricks and tips that is very, very, very important. So once again, let us see if the audience have any questions. So please, you can write down your questions on the Q&A part, and Dr. Andres can answer the questions. So
Please.
yeah, Andres, you know, shifting from, you know, traditional dentistry to digital dentistry, sometimes it's a big challenge for dentists. And I guess with this advantage of using those kind of technologies, especially when you present or share your work with the patients, that will make it big difference and make it confident for the patients to, you know, communicate and understand the treatment. That's very important. How did you find that from your experience?
Well, that's an important thing, you know. It's a great question, by the way. Digital dentistry, you know, and photography are some, they have a lot of things in common, you know. First of all, they're great tools to communicate, you know. We don't have any problem to use it, you know, because everyone is using it, but you can use it the right way, you know. And not only if you want to use it just as a tool, you know, to obtain, for example, you know, I don't know, if you have a good scanner, you know, not only use it for obtain the image or the 3D image about the preps, for example, or pictures. Yes, not only to have a record about the patients, you can use that as a marketing tool. You can use it as a sales tool, because when we talk about treatments, we not only talk about treatments, we talk about sales treatment. So the treatment acceptance about that, is going to be increased if you use that as a tool on your side on the right way. For example, if you show to the patient what is happening with the scanner, if they see that this is my mouth on 3D on a big screen, watch how it looks, the palatal side, it's not something common that the patient is going to see very well. The picture is the same thing, when I show, and I do a lot that, because I work on digital dentistry, I work with photography, and I take a set of 3 pictures to the patient, one on the smile, one on the when he's biting, and the other one with the anterior sector with contrastor. So I take those 3 pictures at the first session. I take around 45 minutes to speak with the patient, hear what he wants, try to understand the needs that he has, and then take all the information and match that with the pictures that I have on the screen on a big screen. So with that information, the patient is going to see what is happening inside your mouth, their mouth. So with that information, you will try to explain what is going to be the options that he has to resolve the problem, And usually the treatment acceptance of that is going to be very high. So it's helpful, 100% agree with that. Digital dentistry is the same thing, but there's another thing that is very important, and I guess we have to do the exercise about it, and we have to be honest about it too. In some moment, when you're alone in front of the screen watching your cases, it's going to happen that you want to see a picture, and that picture, you're pretty sure maybe when you finish the treatment and take the picture, that picture, it was very good because the treatment was great. Then you see the picture and you're going to find a lot of detail, a lot of problems even, or things that are not right, maybe the color wasn't right, the prep wasn't the perfect one, I don't like how this looks, the shape of the crown, the shape of the veneer. Digital dentistry is the same thing. You're going to see your preps, maybe in the vestibular side or front side, you're going to see those margins are perfect, very well done, and then you put the image, on the palatal side, and you'll see that everything's not perfect. It used to happen. And with the pictures, it's the same thing. We have to take the information, and do it better. If you see that your preps, for example, are not the best one, the next time, I'm going to take the picture and make that look better, So you take a lesson from that. You have to be honest about your pictures. And with that information, I'm pretty sure that you're going to be a better dentist every day.
Yeah. And what about for practitioners, when you deal with the colleagues and communications basically with the colleagues, and nowadays, especially within the social media advantage. So how the dental professionals can use that aspect, to increase their communication and to share the advantage of their treatment or disadvantage of the techniques that they use.
Well, depends what do you want to do with that. I use it in different levels, because I work on marketing too. So I use for brands, to communicate. That is one thing. That's why you see a lot of pictures, related with the implants and things like that, or products basically, so that depends what you want to do with that. I have my own account for the practice. So it's going to be changed, it's going to change according to who's going to be your audience, basically. If your audience is going to be people, common people, regular people, patients, you should avoid, maybe surgery and too many bone and blood. But of course, faces works very well. So I put some cases just before and after. If people just want to see, I don't know, no teeth, with teeth, yellow teeth, white teeth, that kind of things, You don't want to go further, about surgery and how this was done, things like that. They want to see before and after, basically, results, and of course, good results. Faces works even better, because the people is used. We love to see teeth, and we understand what is happening there, the process and everything. The patient's not going to understand that. On the other hand, for example, for companies, they know that the case that is done because we have the great combo of titanium, blood and bone. For example, in the case of implants company, they love that. They love that because they know that the patient, sorry, the dentist love that. So they're gonna buy basically because they saw a lot of treatments. So with that information, it's gonna be helpful. So we have to search the right one for us. We can work on different levels. Depends who is going to be our audience. And that's the thing what we have to understand, not all the pictures, because I see a lot, social media. We use social media, dentists, we love social media to work and show our job basically. But the thing is that you can use that as a platform to show, for example, surgery or blood for the common people. It's not going to work because we know that there's some stuff that the people love, we dentists love, but we have to think who's going to be who's going to be the audience for this, the final audience: patients, colleagues, companies, clients. It's different, you see, it's different.
Yeah, you're right. I think you have to decide what's your audience first, then you can go with a different approach.
Exactly.
Yeah.
Or if you want, for example, in my case, I have different accounts. I have accounts for courses. People from the photography course want to see pictures. Okay, perfect. Picture videos. My patients want to see happy people. Basically, they want to see patients before and after, things like that. The team, the staff, happy, sharing. Okay, it's okay. The companies want to see more technical stuff. More information combined with cases and things like that. But my personal account is a mix of things. It's what I do, it's what I do every day. If I don't know, if I work on construction, maybe I was taking pictures, how I was building a house. I don't know. But the thing is that it depends on you. What is going to be your editorial, line for this, what is going to be, how you can develop this. Maybe there's going to be a lot of people that's going to start to follow you because of that content, or maybe depends, what is going to happen and what are you going to show. Dentistry is something complex, I guess, but we can make it look, much, friendly on social media if you do on the right way. That's why picture, I guess, is something important, because you can use it as a channel of communication, and with that, have a message to share.
Yeah, I think that's, as you say, that will be a good channel and also a good window that others can see our profession and our work. So you are doing a very great work that you're showing our profession through your windows. That's fantastic. Thank you so much, Andres, for your time. And I guess the attendees are a little bit shy, or they understood the tips and tricks that you presented, because your work is fabulous. So once again, I would like to thank you for your time and effort to share with us your experience. So as a tradition for Digital Dentix, we would like to present you a certificate of appreciation. So we hereby express our sincere appreciation to Dr. Andres Ponce in recognition of his contribution as a live webinar speaker for the Digital Dentix webinar series on the topic of clinical photography, tips and tricks on the daily practice, that was presented on Tuesday, July 11, 2023. Andres, thank you so much for everything. Thank you.
Thank you so much, Steve.
Yeah, thank you. So attendees, please stay tuned for the bunch of webinars that are coming within the next weeks. So please take care and see you soon in the other webinars. Have a nice morning, nice afternoon, nice evening. Bye-bye, everyone. Bye, Anders. Thank you.
Bye, thank you.